Hello, everyone. I'm your host, Jackie Iverson. I'm the founder of Health Schema, the digital health wallet aimed at bringing personalized medicine as a mainstream practice by bringing a 360-degree view of your healthcare journey so that you can make informed decisions in partnership with your doctors and care providers. Part of the 360 of your healthcare journey, this podcast series feature well-rounded healthcare-related topics that are meant to elevate your whole health. Well, today I would like to welcome my friend Kelly Campbell Martinez. Kelly works for the Department of Public Health and Environment in Weld County here in Colorado. She's the Public Health Communications Manager in charge of health education, communication, and planning there. Hi, Kelly.
Hi, Jackie. Thank you so much for having me today. I'm excited for our chat.
Well, actually, I'm more excited for our chat. Thank you so much for inviting my invitation. You're just amazing because, you teach me how to spend every Friday and burn all these calories. And I know you're very health conscious. So I was very excited to have you on the podcast so you could teach us more about the role of a Department of Public Health and Environment. So not just for Weld County, but for every county in the United States. So could you brief us about what this department's role is in general?
Sure. So I promise I'm not going to be scripted and read off a whole list of things, but I do have to keep in mind that I am a public servant and my bosses are the county commissioners. So I want to at least get this first question right because it's so important. So a lot of people are actually more educated about what public health does after COVID because we were so involved and we were in the media all the time. But prior to that, people were like, what is public health? Well, you should know because your tax dollars pay for our services. So public health promotes and protects the health of all people and their communities. It's a science-based, evidence-backed field that strives to give everyone a safe place to live, learn, work, and play.
Wow, that sounds amazing. So does each department operate differently county to county, or is there a framework that makes everybody kind of similar?
So they're very similar. Some are more robust, meaning they have more programs, but generally most public health departments, so there's local public health, that would be county level, there's state public health, and then of course the CDC, there's the federal. But at the local level, which is what we're talking about today, there's always going to be some environmental health division because we want to make sure as community members that we can breathe clean air and that we have clean water to drink and our food is safe when we go out to eat. So that's one of the roles of public health. Also, most public health departments will have a nursing division for vaccinations, for certain disease control or prevention, for things like that. What's unique about Weld County is we have a very large, probably one of the largest public health education, communication, and planning divisions, which means we have a big division of health educators that work around prevention.
Wow. And it's a free service. Free when people want to access the service.
Right. So for our division, all of the programs that we offer, yes, there is no fee. For some of the other things, like for instance, environmental health, they have permit charges for like septic inspections or tanks, and then the restaurants have to pay a fee just to have a license, and there is some costs involved if you want to go get your birth certificate or your death certificate, which some people don't realize that's where you get it at the Department of Public Health. So there are some fee-based services that we provide, but all of the programs in my division are no cost.
Yeah. So fee-based, it's kind of subsidized by your taxes still.
Yeah. Well, there's some individual costs, yes, but like I said, it's a county department, so we do run on county funds. We apply for lots and lots of grants, and then we do keep our head above water with some of these fees that we charge.
Yeah, and I think you have an awareness program because not everybody knows about this program, and that they can access it, right?
Right.
So that's
yeah.
the issue.
Yep.
Yeah. So in your experience interacting with other departments of public health and environment, what makes Weld County unique from others?
Well, what makes us unique is we are a huge county as far as like,
True.
just the
Wyoming.
size it is. So we got a lot of land to cover, and we have a lot of different areas. We have rural areas, we have urban areas, we have suburban areas. And also we have a lot of really amazing people, but that are culturally very different. I think I had read somewhere that there's over 50 different languages spoke in Weld County. So we have lots of different pockets of, people, and everybody, has different beliefs around health. And so we have to be really culturally competent in how we deliver our services. So those are some things that are real unique to Weld County.
For sure. And actually, I discovered that by volunteering with the Weld County libraries here. And, there's a lot of Spanish-speaking individuals, as well as actually French, because there's a large African population. So it's been great. Considering that, actually, no, I wanted to talk a little bit about the Heart of Weld. You told me that was one of your favorite programs.
Yes, that's my baby. That is my that's my heart and soul. So I actually started working at the Weld County Department of Public Health almost 20 years ago now, and I was hired in as a diabetes prevention and control specialist. And I've progressed through lots of different health education programs throughout the years, including worksite wellness and tobacco prevention and injury prevention. But as I'm approaching the end of my career, I started when I was 12, so I'm going to get to retire when I'm 30. No, not quite. My wish.
Almost.
But,
You look
right.
30.
Oh, thank you. But I'm coming full circle, and I'm getting to come back to, again, where my heart really is, and that's diabetes prevention. So Heart of Weld is a diabetes prevention program, and it's not control. So what that means is we really try to target people that have pre-diabetes. If you have diabetes, that's beyond our scope because we are not clinicians. We don't do medication management. We don't do therapeutic diets. But if we can catch people in that pre-diabetes phase, we can help them either prevent or delay the onset of diabetes.
That's amazing. I mean, considering that Colorado is one of the leanest states with the lowest rate of diabetes in the nation. I mean, that's the rumor I heard.
Right.
Is it true?
Us in Hawaii. Yep.
Yeah.
In Hawaii.
So how did you even find out that there is a diabetes problem here in Weld County?
That's a great question, Jackie. So every year we're mandated by the state health department to do a community health assessment. Every local health department is required to do that. So every 3 years, we do a random survey. We send out over 20,000 surveys to county residents, again, completely random. And it's a very long survey. And it asks them all sorts of questions about their current health status, their current health concerns. And we collect that data, we analyze it, and that's what drives our programming. So the top health issues on the county are the ones that we're going to want to address. And diabetes it always rises to the top. Weld County, yes, Colorado is a very fit and very lean state. However, we still, especially in Weld County, our rate is higher not only than the state average, but also the national average. So we got a pocket of people here that are at higher risk for lots of different reasons.
Yeah, I think it's so innovative because I think I mentioned to you that it was only at the end of March that the National Institute of Health just kind of published research that mentioned that they noticed that people who live in rural areas are more prone to having diabetes than people in more urban areas. So I thought that was interesting because, as you mentioned, Weld County has a huge portion that's rural. So you were in the forefront of that, already taking action. So it's very impressive. But, how many people did you survey in general? How many people participate? Because you said it's pretty lengthy and it's probably available in several languages.
Yeah. Yep. So that's always been, a challenge. So I'm not a data specialist, and they always have a goal, and they know what a good response rate is and what a not so good response rate is. So we send out about 20,000. They can take it the paper version or they can do it online. We send lots of reminders. In fact, we'll send out a postcard before they get the survey. You're going to get a survey. And then they'll get the survey, and then we'll send out postcards. Did you fill out your survey? So there's a lot of reminders. Also, this year, we were lucky enough to get a grant to offer incentives for people to complete the survey. And oh my gosh, that's helped. It's just a $5 gift card.
Yeah.
I don't even know where they got them, but that makes a huge difference. And it makes a difference in all of our programming. So if we get a response rate of about 30%, that is really good. And that's huge. And it's because you're a data person, I mean, that's a pretty significant response rate.
Yeah, that's actually, I was going to suggest, I said, if you don't have enough responses, usually the little carrot.
Yes, the carrot helps. Yeah. And we also, if we don't get enough because again, our county's so big. So if we divide it into quadrants, so we'll send a certain number to each of the quadrants. But if we don't get enough from certain neighborhoods or quadrants, we'll do focus groups. And so we'll go out and we will sit down, we'll invite people to come, offer them a meal, and we'll just do the survey with them. Wow. So if it's underrepresented, for some reason, because we pay a service to give us a list of addresses. So it's random lists. So we contract that out. But we noticed this year there was a high area in the Longmont. Weld County is slightly on the other side of I-25 around Longmont, but it's just a little teeny part. But I think we were going to oversample there. So, we'll continue to do that. But then we need to make sure that we're capturing enough people outside of that area as well. So it's all very scientific. And I'm so glad I didn't major in data when I was in college because it's all above my head. But for me personally, that data is what drives our programming. It also drives our funding because we have to justify when we write grants. Well, why should we give it to you? Well, here's our data. This is why.
That's amazing. I mean, I feel like data is the new economy. You can't do anything without data. And it helps you make so many good and relevant decisions. So it's great. But I also love the format of your program, the fact that you have workshops. And that what I think is amazing is that workshop considers behavioral and mindset. Mm-hmm. Right? Not just habits, like the nutrition part, but also the mindset part. For example, you have classes that talk about healthy eating, but also, kind of like the education for diabetes 101 in a way, right? Mm-hmm. Educating on that. But you also have stress management and staying motivated, which helps you understand your food behaviors because it's related to your stress. Maybe sometimes when you're stressed, you tend to eat more or choose less healthy food, right? Because it gives you that quick jolt, but you pay for it after. So I think the mindset aspect of these initiatives is very comprehensive, right? So how did you, as a department, get inspired with ensuring that all these important components are included?
So actually, the program that we run is a CDC evidence-based curriculum. So the diabetes prevention program that we use is a social science research project done by the CDC. And so it's actually a year-long program. And so we meet once a week for the first 18 weeks, and then we meet twice a month for the months 4 through 6, and then once a month for the last 6 months. But the curriculum is already set. But these classes, Jackie, they're like, I facilitate them. I am not the teacher. I am not really even the coach. I am the facilitator. So it's really, when I think about the hierarchy of health, I think that at the very top is social connectedness. Oh, yeah. If you don't have relationships, are you really going to care what your hemoglobin A1C is, what you're going to eat for dinner, you have to have those social connections. So that's what I love about this class, and the things that you were talking about is we work on the social part of chronic disease prevention and the emotional part and the stress part. But with these DPP classes, it's a group of people that are dealing with the same health issue that talk to each other and motivate each other and give each other tips like, well, this worked for me. You might want to try it. Oh, you can't get to class? Let me pick you up. I really want to see you. And that's what makes the huge difference with this program.
Yeah. It's the community and the connection, the relationship, and a support system, right? And it's so great that you mentioned that, because recently I came across an article that mentioned addiction to drugs, that they actually did some studies with rats, that if the rats were in the cage by themselves, they would always choose, so they were presented with plain water or water laced with cocaine or something.
Right.
And they would always go to the cocaine if the cage only had the water and them in them. But then if they introduced other distractions, like other rats in the mix, or a bunch of toys and obstacles in the cage, that the rat would always go for the clean water.
Wow.
So, the conclusion out of that, too, is that people need connection to remedy their addiction. So,
people need people.
Yeah.
They do.
We're social creatures, even though sometimes we don't want to admit it.
Right.
Especially after COVID, right? A lot of people are like, no, I'm antisocial. But yeah. So that's great. I think, so tell me about your passion in this diabetes prevention and control. I mean, you told me it was your favorite program. I'm curious, and how did you develop that passion? Because certainly you're one of the most healthy person I know.
Right. Well, I appreciate that. But honestly, it's because everyone, literally everybody in my immediate family and my extended family either have prediabetes or are diabetic. I am, knock on wood, the only person at this point that hasn't had it. I lost grandparents to it. My dad's had 2 bypasses because of it. Even my younger sister has diabetes. And, one of the biggest risk factors for developing diabetes is genetics. And that's something, that we can't win that battle, but we can prolong it. So, staying healthy, active, trying to pay attention to my diet for the most part. Again, I mean, we want to enjoy life, but we can still enjoy life and, have a good diet and be physically active. So that's where my passion comes from. Is it's just been part of my world forever. And losing loved ones and really, with especially with prediabetes, the goal of the class, other than making those social connections, is to lose only 5 to 7% of their starting body weight. So let's say somebody comes in weighing 200 pounds. If they can lose, even about 10 pounds, that significantly improves their blood sugar. That's doable in a year. And then 150 minutes of physical activity a week. Like, Jackie, you and I do that in 2 days. But so that just shows you that even just 150 a week, that's 20 a day. People can walk 20 minutes a day.
Absolutely.
And then, just watching, you can still have all your favorite foods, but watching the portion sizes and increasing the fiber and increasing the protein. So very simple things. And that information needs to get out there. You can make significant changes with just simple little tiny things. So, don't throw the hat in because you've been diagnosed with prediabetes. I always tell my classes, nobody wants to hear a diagnosis of prediabetes, but it's almost like a note from, whoever our God is or whatever, that says, hey, look, you're going down a bad path, but I'm giving you an opportunity to turn it around and maybe never have to go down that path.
Yeah, that's amazing. And do you know what? 10 pounds, that sounds like trivial, but honestly, I saw a nutritionist one time that kept on putting these pounds of fat in jars. And it would show 1 pound, 5 pounds, 10 pounds. And when I looked at the 10 pounds, I was floored. Like, it was a huge jump.
Right.
That is the amount of fat we can carry around,
I know. I always get that question. Is 1 pound of muscle really the same as 1 pound of fat? And it's like, well, a pound is a pound. But because you've seen those models, it's like if you've ever seen a muscle model, it's very compact and small. That's a pound. You see a pound of fat, it's fluffy, and it takes up a lot of space. So, you lose 10 pounds of fat and it's pretty noticeable.
Yeah, absolutely. But speaking of genetics, so about 10 years ago, I experienced bouts of increased intestinal permeability.
Mm-hmm.
And so I actually went to a holistic nutritionist because I'm kind of a hippie like that.
Yes, I love it.
who actually proceeded with genetic testing and had me create a food diary. And she gave me some glucose monitors, and I had to log my blood sugar spikes with every meal. She wanted to understand not just what my diet habits were, but to see if I had spikes even eating certain healthy food. You automatically think if it's a vegetable, I shouldn't spike. But, based on our genetics, also certain foods are not really compatible and they cause your glucose to go up.
Mm-hmm.
So surprisingly, that's how I discovered the field of nutrigenomics.
Mm-hmm.
So if you read research about this, and it says, so nobody has the same, makeup genetically. So then we don't have the same food tolerance either, and that can contribute to diabetes also.
Mm-hmm.
So is this a kind of an aspect that you could introduce as part of building awareness? Because it's not just nutrition, but there's also the genetic component that could influence that in their food intolerance or tolerance, right?
Right. Yeah. So, as far as that's concerned, yeah, it's definitely something that, I definitely need to study more about that as well. But I think it would be great to talk to certain groups about that. It is very costly and very time consuming.
Yeah.
So, when we're dealing with, or we're speaking to populations or have populations in our class that really, have some significant financial barriers, and also health literacy barriers. I mean,
True.
meaning, they don't understand or they just haven't been educated on health and, what different aspects mean. So I think it would be definitely appropriate with some groups that we work with. We do a lot of corporate wellness education, but some of the other groups. So it just really depends. I'm all for it. You had brought it up in your questions, and I was like, ooh, I even want to, learn more about this because like you, I love holistic health and I love studying all sorts of different, theories and new things that are coming out because it's always evolving. It's always getting better.
Right. And I like the personalized aspects of it too, right? Because it's really, I don't believe healthcare is a one size fits all.
No.
Because we're so different and there are so many other, components like your environment and your diet and, the pollution you're exposed to, et cetera, et cetera. But shifting gears a little bit, I'd like for you to talk about the mobile clinic because, I think it's fascinating. So how did your department come up with that initiative? Is it mainly to serve rural populations or tell me a little bit about the process of creating that?
So, we're super lucky. We just launched our public health mobile unit. And part of it, the biggest part was we want to bring healthcare to people, especially in rural communities, especially lower income areas, neighborhoods, because sometimes transportation is a barrier and they just can't drive to the health department. We do have a couple of different clinics throughout Weld County, but if you don't have a car, how are you going to get to your vaccination appointment? So just bringing healthcare to the people. Our public health mobile unit will offer free or low-cost services. So if they're like immunizations, they're going to probably have a small fee or a sliding scale fee, but all of the screenings that my department does will be free. So we'll do education and screenings and, basically anything that health-related that, businesses or neighborhoods or groups are interested in, we can probably drive our unit out there. In fact, my boss is like, we just could use it as a billboard too. And I'm like, perfect. I'll have it at the pool every Friday from 10 to 3 using it as a billboard. But it's very exciting. It's a beautiful unit and it's got 2 exam rooms in it and Wi-Fi and it's fantastic.
Wow. I'd have to get a tour sometime.
Yes, absolutely. It's in fact, it's going to be at the Link Library here in a couple of weeks. So, but people, that are interested in just going on a tour, it'll take literally 2 minutes, but
Yeah.
I'll show you.
You can pack a lot of stuff in there.
Right,
That's kind of
right.
fascinating. So how many of those do you have? Just one?
Yep. So we just have one, and we just got it. There was a outfit in Fort Lupton that custom built it for us, basically customized it for us. It's just shiny and new. We have one. There's a couple other, maybe 2 or 3 other health departments, maybe in the States. So it's one of a few that have them. I know another Sunrise Community Health Centers here in Weld County also has one. So they're not every health department has been blessed with having the commissioners support something like that and being able to get that.
Yeah, but it makes sense, though, seeing that Weld County has a huge rural population. I mean, it's perfect. So how many patients would you say, in average, that do you serve per month with a clinic?
Right. So we have only been out a couple of times. National Public Health Month or week was last week, and that's when we introduced it to the public. So we've had it out at UNC a couple of times, and we've had it at university schools. And it doesn't always have to provide services. We can do outreach and education. So there's lots of different uses for it. But we plan to have it out 4 days a week, every week. So just got it reserved at the Stampede. So we'll be offering screenings at the Stampede. So right now we're not exactly sure of what the numbers are, but the goal is to have it out 4 days a week doing something. So, that's really easy in the summer because we can go to migrant farms and we follow the food bank's mobile food pantries. So when they go to all these communities to do the food distribution, we're going to be there with the mobile unit too. So our numbers are going to be huge in the summer and then, dwindling off in the colder weather. But our unit has a fantastic heating unit and air conditioning. So no excuses for us to get out of it if the weather's cold.
Spoiled.
Yes, it is nice.
Living.
Right? I know. I'm thinking, well, that could double as a camper. So
totally. Let's go camping with a clinic.
If the mobile unit's missing, go tell the police department to search for Martinez up in the mountains.
That wouldn't be bad. Bring me with you.
Right. We'll go. Girls trip.
So do you have any statistics yet, since you just got the clinic? So I was wondering if you have some statistics about improved patient outcomes as a result of having this mobile clinic. I just want to inspire other departments of health, right, that may be thinking about investing in one, because there's a lot of rural communities in the U.S.
Right. So we don't really have those numbers yet because, like I said, we just launched it a week ago. But just some advantages of the mobile unit is just going to be the accessibility first and foremost, just bringing that healthcare to more areas, reaching underserved communities. So there's pockets all over Weld County where they don't even have a clinic. Also doing outreach and education, so we can do those diabetes classes right out of that unit if we want to. On some occasions, it may need to be used for emergencies. So think of during COVID, it would have been wonderful to have this unit to do the vaccinations and the testing. So if there's an emergency, we can deploy it. Efficiency, we can do lots and lots of vaccinations all at one time. You don't have to have an appointment. We can show up with our unit. You can just show up when when you have time, and we'll vaccinate you. And then also offering primary care, because a lot of especially, just in the climate right now, there's a lot of hesitancy for certain populations. They just don't want to even leave their house, much less, come into a government agency to get primary care, but they need it. So, building that trust in the community and getting them the services that they need is going to, the mobile unit will help with that. And that's really, really important.
That is amazing. That's really equitable health, right?
Yes.
So did you hear Colorado State University, CSU, just created a mobile clinic that's equipped with artificial intelligence?
Oh, wow. Now we're behind the game. Darn, we see you're on top of it for a whole week, and now we're behind. Tell me more about that.
Well, they didn't say Larimer County has it yet, but it's a concept, and I think it would be amazing, right? So then, from your standpoint, are there any challenges that with the mobile clinic that you have? Is it lacking something? Do you wish you had more connectivity to internet to be able to enter patients' information in the electronic health record?
Right.
Are there some challenges?
Yep. So we can actually do that. So the mobile unit does have Wi-Fi as long as there's good connection, like you said. But there are some limitations to the rural clinic. There's going to be some limited resources, first of all, because of the size. So rural clinics often have fewer resources, including equipment and specialized medical staff. So, we'll have, depending on what we're going out for, we may have nurse practitioners and nurses. But if it's me going out, I'm not a doctor, and I do most of my programming with community health workers who are absolutely amazing. They're just, they're trusted members of the community that speak Spanish that are very approachable and very trusted. But, they're lay health workers. And so that's, sometimes a significant limitation. And if you don't have those professionals like the doctors and the advanced nursing care, dealing with complex cases is it's a lot more challenging. So, yeah.
Well, you're a pro at this, Kelly. It's been so great to talk to you. You're dynamic. You're like dynamite. That's awesome. But, any closing comments? I mean, I think it's been a great conversation.
Yeah, of course. Yeah, really, I just want people to understand at the end of the day that public health is not just about medicine. It's about people. It's about compassion and community. So public health actually, if you think about it, touches every part of our lives, from the air we breathe to the food we eat. If we all just stay curious, just like you, with all these, different things that I don't even know about, stay informed and look out for one another, we'll keep making progress.
Wow.
Thanks so much, Jackie, for having me. This has been a great conversation.
Yeah, thank you so much for educating us. I actually have been enlightened because there are so many aspects of the healthcare department that I wasn't aware of. But thanks, everybody, for joining us again in this episode of Health Schema. And I hope you were able to learn useful information about the role and purpose of a Department of Public Health and Environment. Until next time, we wish you all a wonderful day. Bye for now.